There are two kinds of rhinoplasty: primary rhinoplasty and secondary rhinoplasty. Primary rhinoplasty is when you operate in a virgin nose that hasn't been touched before. Secondary rhinoplasty is when you have to reoperate on those patients who had an unsatisfactory outcome from previous rhinoplasties. When I do primary rhinoplasty, I think not in the immediate result, I think in the long-term result. And I have coined the expression of superstructural rhinoplasty, which means that when you are doing modifications of the nasal structure to provide a different shape of nose, to remove a hump, to elevate the nasal tip, change the nasolabial angle, etc. Every time you do some surgical maneuver, you're going to break some of the natural structures of the nose. The nose is going to become weaker. If you don't repair and reconstruct the support of the nose after a few months or years is going to collapse. So it's important when I do rhinoplasty, and this is the way how I address my primary rhinoplasty, is to repair the structures that have been touched to do the modifications I wanted to do. One of the important factors in rhinoplasty is, number one, usually the patient's expectations is very high. Number two, the nasal airway has very limited tolerance to be narrow. Number three, the nose is one of the few structures in the face in which you are dealing with this peculiar tridimensional structure that, in addition of having thin skin, thick skin, has bone, has cartilage, has also spaces. So those spaces that naturally exist for you to be able to breathe is also a trap, because toward those spaces is that the nose can shift and produce deviations from the midline, can produce collapse of the nasal valve that prevents good nasal airway breathing, and also produce some retraction of the nasal ala, or some downward migration and drooping of the tip. So by the time that I finish with the primary rhinoplasty in my patients, those noses should look like didn't have any surgery. They should look natural. They should have a good nasal airway without any obstruction. They will look beautiful, and they will look well balanced, that fits the patient's face. Because my ethnic background, I'm Hispanic, I draw a lot of patients from my ethnic background. But also because I travel all over the world teaching, I had the referrals, and patients travel to see me for rhinoplasty and other procedures. Therefore, I have to address the noses that are different for each particular ethnic group. An Afro-American nose, and a Middle Eastern nose, a Hispanic nose, they are completely different. They have some common grounds, but also they are different. So you have to individualize the surgery for the patient and for the particular ethnic group.